Hello everyone, today we're going to discuss an important topic related to medical devices and the potential for scams involving them. Specifically, we'll be focusing on the EpiPen scam, a recent incident where a well-known pharmaceutical company, Mylan, listed an expensive, life-saving device as a generic medication. The EpiPen is an expensive and widely used medication for treating bacterial infections in patients of all ages. It is a name-brand device that costs thousands of dollars and is crucial for treating life-threatening situations. However, Mylan decided to list it as a generic medication, which allowed them to sell it at a significantly lower price. This decision raised concerns among healthcare professionals and patients alike, as they wondered why Mylan made such a move. There are several reasons why Mylan chose to list the EpiPen as a generic. Firstly, generics are designed to be nearly identical to the original medication, with the only difference being the packaging and labeling. This ensures that the patient receives the same medication that was prescribed by the healthcare professional, and that the manufacturer's warranty remains intact. Secondly, Mylan recognized that the EpiPen was a name-brand device that had a strong market presence. By listing it as a generic, they were able to tap into the existing customer base and potentially attract new ones. This strategy has been successful for Mylan in other instances, as they have been known to offer generic versions of popular medications at a lower price. Pharmaceutical companies like Mylan Inc. and Mylan Specialty LP are required to pay rebates under the Medicaid drug rebate program. And misclassifying EpiPen as a generic drug to avoid these rebates is considered illegal. 1. Medicaid Drug Rebate Program. The Medicaid Drug Rebate Program was established by Congress to ensure that state Medicaid programs, which provide healthcare services to low-income individuals, were not overcharged for prescription drugs. The program is designed to control the cost of medications provided to Medicaid beneficiaries. 2. Rebates for brand-name drugs. Under this program, pharmaceutical companies are required to provide rebates to state Medicaid programs for the drugs they manufacture and sell to Medicaid beneficiaries. The rebate amount for brand-name drugs is typically higher than that for generic drugs. 3. Generic vs. brand name classification. Generic drugs are generally less expensive than brand-name drugs. Therefore, to encourage the use of cost-effective medications, the program offers lower rebate rates for generic drugs. Brand-name drugs, on the other hand, are subject to higher rebate rates to help offset their higher costs. 4. Misclassification as generic. In the case of EpiPen, Mylan allegedly misclassified it as a generic drug when it was, in fact, a brand-name drug. By doing so, Mylan paid lower rebates to Medicaid than it should have, effectively avoiding its financial obligations to the Medicaid program. Why this was illegal. 1. Violation of False Claims Act. Misclassifying EpiPen as a generic drug to avoid paying the higher rebates required for brand-name drugs violated the False Claims Act. This federal law makes it illegal to knowingly submit false or fraudulent claims for payment to the government. By misrepresenting EpiPen's classification, Mylan was essentially making false claims to Medicaid. 2. Fraudulent scheme. Mylan's actions were viewed as a fraudulent scheme to maximize its profits at the expense of the Medicaid program and taxpayers. This is considered an illegal and unethical practice that undermines the integrity of government healthcare programs designed to assist vulnerable populations. In summary, pharmaceutical companies are required to pay rebates to Medicaid based on the classification of their drugs as either brand name or generic. Misclassifying drugs to pay lower rebates is illegal under the False Claims Act because it constitutes fraudulent actions aimed at avoiding financial obligations to the Medicaid program. Mylan's agreement to pay $465 million is a resolution to the allegations that it engaged in such illegal activities.